Amid rampant misinformation and stringent abortion restrictions, this stark image reveals the hidden reality of later stage abortion procedures and helps to convey why access remains essential in certain circumstances.
This photo was taken by Maggie Shannon for a New Yorker photo essay about a Maryland clinic providing later stage abortions. The clinic gave Shannon access to help lift secrecy around these procedures, which are often sought due to fetal abnormalities, maternal health risks, barriers to early abortion, or late pregnancy discovery. The article estimates that only about a dozen U.S. clinics provide abortions after 24 weeks and up to 34 weeks in this Maryland clinic. The photo shows a staffer placing a sheet between a patient and clinician who is administering an injection to stop the fetal heartbeat as part of the procedure.
These photographs are important because they visualize medical procedures that have been largely invisible. What Shannon gives us here as viewers is we really get to see both sides of the sheet. The whole photo series, and this photo in particular, is really giving us access to this procedure in a way that we have not had before. It's important for the public to see images like this to counter the often misleading labels that are given to the abortion process, particularly in the second or third trimester. There are often a lot of inaccurate and non medical terms and labels used at this moment, and those do nothing but really distort and politicize the public conversation about reproductive health care. When we look at the shadows in the photograph cast by the lighting and perhaps the flash, is they signal that there is always something lurking in the shadows, metaphorically speaking, regarding these challenges to reproductive rights and challenges to reproductive justice. The shadows remind us that these are spaces that are increasingly rare and endangered. And I think they're also there because, by contrast, the photographer's trying to shed light on a subject that we haven't seen before and that literally has been kept in the shadows. And she's inviting us to experience that.
The shadow speaks to the looming implications for both the patient and the medical staff. Also, the weight of the decision, the personal impact of the procedure, but particularly the dark shadow cast on providers by the political environment and radical new legal restrictions.
I'm also struck by Shannon's choice to use black and white. That choice certainly links the photograph series to what we might think of as a more traditional documentary style, signaling that these images are going to be interpretations of actuality, that they're going to involve a kind of communication of aspects of the patient and the provider's reality. But I also noticed that the black and white isn't super high contrast. There's a lot more kind of middle tones in the image, maybe pointing to literally or figuratively to gray areas in this form of medical treatment. What we see in these images is a variety of people coming together to create the possibility for people to undergo this procedure in a way that's safe, thoughtful, and empathetic. So in the images, we see medical personnel interacting with patients, gathered together with one another, images of family members, and this idea of support people who are all undergoing the experience together.
You can see the commitment and also the will involved in providing this kind of care in the intensity of the clinician's gaze. I'm assuming she's checking a device to monitor vital signs. It also illustrates the quality of service in this adverse political environment at an excruciating moment in these patients' lives. For health workers, it demands both the highest level of skill and the deepest form of compassion. That commitment is also punctuated by the photograph of the OBGYN, where we see her clutching the necklace with the coat hanger symbol. With all the judgment and misunderstanding about abortion, especially in the later stages, it's essential to bring these procedures into the light.